What are the physical exam findings in a patient with tricuspid stenosis? Let's go ahead and review them together. We use the term script to examine heart murmurs. S stands for site or location. The murmur caused by TS is best heard at the lower left sternal border. Herb's area is also involved. C stands for character. The murmur from TS has a rumbling quality, meaning it sounds like grating or like dragging a fingernail across a hard surface. R stands for radiation. Because the murmur from TS is usually very faint, it typically doesn't radiate anywhere. I stands for intensity. The murmur from TS depends on the pressure gradient across the valve, and its intensity can vary, but it's usually mild. P stands for pitch. This murmur is low-pitched and low frequency. T stands for the timing of the murmur caused by TS, which is diastolic, meaning it's heard between S2 and S1. A patient with tricuspid stenosis also has some other features on physical examination. In these patients, the jugular venous pressure, or JVP, is elevated. The pressure in the right atrium increases. And since there's no valve between the right atrium and the venous system, this pressure is transmitted to the SVC and IVC. The increased pressure in the SVC presents itself as elevated JVP. In a patient with severe TS, in addition to JVP distension, the A wave also becomes prominent, and the Y wave becomes blunted. That means the slope of the Y wave decreases. What is the reason for these changes in the jugular venous curve? During diastole, blood enters the ventricles from the atria in two phases. One is early diastole, and the other is late diastole. Early diastole happens because of the pressure gradient, and right at the start of diastole, as soon as the valves open, blood flows from the atria into the ventricles. But in a patient with tricuspid stenosis, because the tricuspid valve is narrowed, the flow of blood from the atrium to the ventricles happens slowly and gradually. Therefore, the Y wave, which represents early diastole, appears blunted. In other words, the slope of the Y wave decreases. And on the other hand, at the end of diastole, the remaining blood in the atria enters the ventricles through atrial contraction. But again, because of the tricuspid valve stenosis, when the atrium contracts, instead of the blood flowing from the atrium into the ventricle, it flows back and enters the SVC and IVC. Therefore, the A wave, which represents atrial contraction, increases in height and leads to the formation of a prominent A wave. The next characteristic is in the heart sounds. The first feature is the right-sided opening snap. An opening snap is the sound of the tricuspid valve opening, which is heard at the beginning of diastole, that is, immediately after S2. As we mentioned, in the heart, the opening of the valves does not produce any sound, and the sounds we hear are due to the closing of the valves, unless there is a pathology present. In a patient with tricuspid stenosis, because the valve leaflets have become thickened and stiff, their opening also produces a sound. And since the opening of the tricuspid valve happens at the beginning of diastole, the opening snap is also heard immediately after S2. And the more severe the tricuspid valve stenosis is, the earlier the opening snap will occur. So, the opening snap gets closer to S2, and the interval between the opening snap and S2 decreases. If you found this part of the video helpful so far, please like it and share it with your friends. And if you don't want to miss my upcoming videos, please subscribe. The next characteristic is due to the high pressure in the right atrium. In patients with tricuspid stenosis, because of the increased pressure behind the valve, this elevated pressure is transmitted to the SVC and IVC. In the SVC, it presents as an elevated JVP. It shows up as hepatomegaly, lower extremity edema, and ascites. And in these patients, the hepatojugular reflex is positive. That means if we place our hand on the upper abdomen and apply pressure, it causes the JVP to increase. And finally, in TS patients, Kussmaul's sign is present. That means during inhalation or inspiration, instead of the JVP decreasing, it actually increases.